says, I know I have ADHD and migraines. I cannot tolerate stimulants. I want to know one or two supplements or maybe foods or lifestyle changes. Like, what can I do right now that you, based on your vast experience with this, think would probably produce some benefit for people?
Yeah, there's some, things that you don't need to test for. Of course, testing is best, but omega-3s, a
Mm,
great quality omega-3 supplement.
hmm.
It's so good for the brain. It lowers
Yes.
inflammation. I think everybody should be taking it.
Yeah, for
Um,
sure.
yeah, and it's for ADHD and migraines. I think it's imperative to take that.
Yeah.
Magnesium as well. Most people are
Ah.
deficient in magnesium, and most people with ADHD are. It's
Mm.
one of the nutrients that tends to be low. And there's a form of magnesium, magnesium threonate, which crosses the blood-brain barrier and could be more beneficial than other forms.
And you know
So,
what's so interesting? Both
yeah.
of those are, there's great data for both of those for people with migraine. Studies, one study even showed that increasing omega-3 consumption in food, just food, not even a supplement, was enough to cut headaches in half in 3 months. That study was published in 2021. And we have over 200 different studies showing that magnesium reduces migraines. So I think it's so interesting. There's so much overlap between the two things. I mean, it makes sense. It's all coming from the brain. And I think that just goes to, it's like further evidence that when you dig below the surface of just symptom pill, and you dig down and say, okay, wait, but why? What's going on at the level of the cell that needs to be fixed? Like you fix the cells, you fix so many different symptoms, you know? So it's really a
Yeah,
much more
absolutely.
powerful thing. Yeah.
From a functional perspective, people with ADHD have a dysfunctional with the way they use glucose. So they have
Mm.
an abnormal response. So really high highs and really low lows. And that drives symptoms. And we also know that hypoglycemia triggers migraines. So
Mm.
it's something
Mhm.
that plays a role in both, and something as simple as regulating your blood sugar throughout the day by, adding fiber and protein to every meal and every snack. Like, don't have naked carbs,
I
if you,
love that. No naked
right.
carbs. Yes. So, what do you think about things like EGCG? So, that's the active ingredient in green tea. And of course, it's in a much more concentrated form in matcha. Do you think that has a role here?
Love green tea, love matcha. So many benefits, antioxidants, polyphenols. One thing I would say is for someone with ADHD or migraines, if they have the COMT gene, EGCG will slow it down even more. It's an inhibitor. So while it's so beneficial generally for somebody with that variant, it could do more harm than good.
So you really want to know if you have fast comp or slow comped, because if you have fast comped, it would help you to slow it down. But if you have slow comped, slowing it down even further, you're not going to be one of the people who benefits from that.
Absolutely. And it's the
Yeah.
same with rhodiola, which is a great herb. It's very beneficial, could be beneficial for people with ADHD, but again, it inhibits COMT. And that's actually one way it could really help for people with fast COMT. It'll help you get some extra dopamine, right? That one will affect dopamine. Um, but if you already have a slow variant, you definitely don't want to do that.
So that's really, really true too. I just want to emphasize, like rhodiola actually does increase dopamine release. You know, those little balls, the little balls with the red things inside that we were looking at, it literally stimulates the release of more dopamine. So many plant compounds have tremendous and powerful physiological effects on the body. It's just such fascinating stuff. Yeah.
It's a great one. And without a genetic panel, there's probably a lot of trial and error. And you
Right.
try it, you see how someone feels. Which to me, the value of having nutrigenomics up front, you kind of skip all that.
I like to say, without having your genetics, it's like trying to bake a cake without a recipe. You might not get it right. You probably won't. There's gonna be a lot of trial and error. It's a whole lot better to just get the recipe and do it right.